Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX Peer Review Lesson 17. We're going to be doing respiratory medication questions. You can follow me on Facebook, Instagram, and TikTok to get any updates. Links will be in the description. Without the way, let's get started.
Question 1. A client is to begin a 6-month course of therapy with isoniazid. The nurse should plan to provide which information to the client? A. Drink alcohol, in small amounts only. B. Report yellow eyes or skin immediately. C. Increase intake of Swiss or aged cheeses. D. Avoid vitamin supplements during therapy. The correct answer is B. Report yellow eyes or skin immediately. Rationale: isoniazid is hepatotoxic, and therefore the client is taught to report signs and symptoms of hepatitis immediately. For the same reason, alcohol should be avoided during therapy. The client should avoid intake of Swiss cheese, fish such as tuna, and foods containing tyramine, because they may cause a reaction characterized by redness and itching of the skin, flushing, sweating, tachycardia, headache or lightheadedness. The client can avoid developing peripheral neuritis by increasing the intake of pyridoxine during the course of isoniazid therapy. Question 2. A client has been started on long-term therapy with rifampin. Which information about this medication should the nurse provide to the client? A. Should always be taken with food or antacids. B. Should be double-dosed if one dose is forgotten. C. Causes orange discoloration of sweat, tears, and urine. D. May be discontinued independently if symptoms are gone in 3 months. The correct answer is C. Causes orange discoloration of sweat, tears, and urine. Rationale: rifampin should be taken exactly as directed. Doses should not be doubled or skipped. The client should not stop therapy until directed to do so by a healthcare provider. The medication should be administered on an empty stomach, unless it causes gastrointestinal upset, and then it may be taken with food. Antacids, if prescribed, should be taken at least 1 hour before the medication. Rifampin causes orange-red discoloration of body secretions and will permanently stain soft contact lenses. Question 3. The nurse has given a client taking Ethambutol information about the medication. The nurse determines that the client understands the instructions if the client states to report which occurrence immediately. A. Impaired sense of hearing. B. Problems with visual acuity. C. Gastrointestinal side effects. D. Red-orange discoloration of body secretions. The correct answer is B. Problems with visual acuity. Rationale: Ethambutol causes optic neuritis, which decreases visual acuity and the ability to discriminate between the colors red and green. This poses a potential safety hazard when a client is driving a motor vehicle. The client is taught to report this symptom immediately. The client is also taught to take the medication with food if gastrointestinal upset occurs. Impaired hearing results from antitubercular therapy with streptomycin. Red-orange discoloration of secretions occurs with rifampin. Question 4. Cycloserine is added to the medication regimen for a client with tuberculosis. Which instruction should the nurse reinforce in the client teaching plan regarding this medication? A. To take the medication before meals. B. To return to the clinic weekly for serum drug level testing. C. It is not necessary to restrict alcohol intake with this medication. D. It is not necessary to call the healthcare provider if a skin rash occurs. The correct answer is B. To return to the clinic weekly for serum drug level testing. Rationale: Cycloserine is an antitubercular medication that requires weekly serum drug level determinations to monitor for the potential of neurotoxicity. Serum drug levels lower than 30 microgram per milliliter reduce the incidence of neurotoxicity. The medication must be taken after meals to prevent gastrointestinal irritation. The client must be instructed to notify the healthcare provider if a skin rash or signs of central nervous system toxicity are noted. Alcohol must be avoided because it increases the risk of seizure activity. Question 5. A client with tuberculosis is being started on antituberculosis therapy with isoniazid. Before giving the client the first dose, the nurse ensures that which baseline study has been completed. A. Electrolyte levels. B. Coagulation times. C. Liver enzyme levels. D. Serum creatinine level. The correct answer is C. Liver enzyme levels. Rationale: isoniazid therapy can cause an elevation of hepatic enzyme levels and hepatitis. Therefore, liver enzyme levels are monitored when therapy is initiated and during the first 3 months of therapy. They may be monitored longer in the client who is greater than age 50 or excessively drink alcohol. Question 6. A client is receiving acetylcysteine, 20% solution diluted in 0.9% normal saline, by nebulizer. The nurse should have which item available for a possible adverse event after giving this medication? A. Ombu bag. B. Intubation tray. C. Nasogastric tube. D. Suction equipment. The correct answer is D. Suction equipment. Rationale: acetylcysteine can be given orally or by nasogastric tube to treat acetaminophen overdose, or it may be given by inhalation for use as a mucolytic. The nurse administering this medication as a mucolytic should have suction equipment available in case the client cannot manage to clear the increased volume of liquefied secretions. Question 7. The nurse reinforces client instructions about ethambutol. The nurse determines that the client understands the instructions if the client indicates to report which occurrence. A. Impaired sense of hearing. B. Distressing gastrointestinal side effects. C. Orange-red discoloration of body secretions. D. Difficulty discriminating the color red from green. The correct answer is D. Difficulty discriminating the color red from green. Rationale: ethambutol causes optic neuritis, which decreases visual acuity and the ability to discriminate between the colors red and green. This poses a potential safety hazard when driving a motor vehicle. The client is taught to report this symptom immediately. The client is also taught to take the medication with food if gastrointestinal upset occurs. Impaired hearing results from antitubercular therapy with streptomycin. Orange-red discoloration of secretions occurs with rifampin. Question 8. The nurse has a prescription to give a client albuterol and beclomethasone dipropionate by metered dose inhaler. How should the nurse administer these medications? A. Give albuterol first and then the beclomethasone dipropionate. B. Distressing gastrointestinal side effects. C. Have the client alternate a single puff of each, beginning with the albuterol. D. Have the client alternate a single puff of each, beginning with the beclomethasone dipropionate. The correct answer is A. Give albuterol first, and then the beclomethasone dipropionate. Rationale: albuterol is a bronchodilator. Beclomethasone dipropionate is a glucocorticoid. Bronchodilators are always administered before glucocorticoids, when both are to be given on the same time schedule. This allows for widening of the air passages by the bronchodilator, which then makes the glucocorticoid more effective. Question 9. A client has begun therapy with theophylline. The nurse tells the client to limit the intake of which of the following items while taking this medication? A. Oranges and pineapple. B. Coffee, cola, and chocolate. C. Oysters, lobster, and shrimp. D. Cottage cheese, cream cheese, and dairy creamers. The correct answer is B. Coffee, cola, and chocolate. Rationale: theophylline is a xanthine bronchodilator. The nurse teaches the client to limit the intake of xanthine-containing foods while taking this medication. These include coffee, cola, and chocolate. Question 10. A client with a prescription to take theophylline daily has been given medication instructions by the nurse. The nurse determines that the client needs further teaching about the medication if the client makes which statement? A. I will take the daily dose at bedtime. B. I will drink at least 2 liters of fluid per day. C. I will avoid over-the-counter cough and cold medications unless approved by the healthcare provider. D. I will avoid changing brands of the medication without healthcare provider approval. The correct answer is A. I will take the daily dose at bedtime. Rationale: the client taking a single daily dose of theophylline, a xanthine bronchodilator, should take the medication early in the morning. This enables the client to have maximal benefit from the medication during daytime activities. In addition, this medication causes insomnia. The client should take in at least 2 liters of fluid per day to decrease viscosity of secretions. The client should check with the healthcare provider before changing brands of the medication. The client also checks with the healthcare provider before taking over-the-counter cough, cold, or other respiratory preparations, because they could cause interactive effects, increasing the side effects of theophylline and causing dysrhythmias.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.